So our next project is reshaping the approach of health career advising at UC Davis, and that will be presented by Joanne Snap, Elio Gutierrez Montoya, Mary Rose St. Cyr, Ed DeGang, Dr. Jose Morfin. I'd like to invite you to the stage.
All right, thank you. So we're Team D, and when we set out to try to figure out where the challenges occurred in the pipeline into health professions program, we all agreed that many of the pre-health students started experiencing problems in their first couple of years of college when they were taking the intro science classes. So we started to think about how can we address that problem, right? And we can't go back and change the K through 12 systemic problems that lead to that. And we're probably not going to reach all science faculty. So we thought about what other population has access to this group of students on a regular basis. So we thought pre-health advisors and academic advisors are meeting with these students regularly. And we're also aware that a lot of advisors are doing what we call dream crushing. As soon as students start to experience a little challenge or a little difficulty in their intro science classes, they're often discouraged from pursuing professional school. So we set out to create programs that worked with advisors, academic advisors and pre-health advisors, to teach them some holistic advising practices and to maybe educate them a little bit about on the various routes to medical school. So Elio's going to tell you a little bit about what we did with that.
Thank you. Thanks, Joanne. So we had 3 different encounters with advisors, and they're listed above. But we started with the holistic advising training back in August, and then most recently we started a series actually last month, which is our 3rd point. But I actually want to focus on our 2nd point because I think that part of not just reaching our target audience is also understanding what their challenges might be that they're encountering on their own campuses, as well as their successes. So the pre-health advisors meeting at the conference that happens here yearly was a fantastic place where we can have that conversation. So we had advisors throughout California, some people from Nevada that I personally met that actually engaged in a conversation about what it was that they are doing right or they feel they're doing right, encountering our URM students and pushing them down the pipeline as well as their challenges. And I think that it really helped feed what our next steps were going to be and as well as our results, which I'll pass on to Mary to speak about. Oh no, to Ed.
Thanks, Elio. So as a result of our 3 events, we reached approximately 100 advisors and received a relatively positive feedback. The feedback we received from the first 2 events, we recognized that there was a lack of a network through which advisors in the region stay abreast of trends and current information as it relates to admissions practices. So as a result of that finding, we decided to develop a webinar to reach the more people broadly, and we'll continue to develop ways to network. And lastly, through this project, we connected with the Science Educational Equity Program at Sacramento State University, and we intend to pursue future planning with them. Mary.
Thank you, Ed. So future steps. We plan on hosting a local area networking meeting for Northern California health professions advisors to share promising practices and model programs, an effort to communicate up and down the pipeline. We plan to further develop the Health Community of Practice webinar series for our health professions advisors, as well as we look forward to continuing our conversations with science faculty and collaborating with local undergraduate institutions to host pre-health holistic advising trainings. Lastly, as a result of this work with the community of practice, Elio and I will be hosting monthly advising sessions here on campus for post-bac students and other students who are interested in alternative pathways to medicine. Thank you.
All right, so I guess so as we all know, I think it was stated earlier, I think there's a lot. Advising is a big, big task. And oftentimes the advisors are the most probably under-supported. I know some of us do advising for student to student, but those who've been in any career you're in, you've had advisors, and sometimes those advisors say good things. In my personal experience, and we know from our students, is that oftentimes sort of they hang on to the negativity, even though maybe the advisors are well-intentioned, and oftentimes because of so much the caseload an advisor may have, anything we could do to sort of bridge that gap, to provide a professional, bring in people who are on the other side of admissions, to arm them with tools and say these advisors aren't bad people. They just oftentimes just need some guidance themselves. And how do you encourage someone who has potential but yet has off to a slow start, as oftentimes our students are dealing with a lot of things that are not optimal. They're having to work when they go to school, they're having to deal with financial burdens, et cetera, family events. And so I think we have to sort of be able to connect our advisors, especially in this region, community colleges. I've gone through the community college system myself, and I think we all have anecdotes, but I think if we can actually measure it in a meaningful way and be able to capture some data about attitudes of our advisors and how we can maybe swing the pendulum towards a more positive, inclusive environment to really take advantage of our students and promote our students in this environment. I think that's really ultimately our goal, and I think that the work that we've done and the work that others are doing, I'm looking forward to more engagement and discussion with others in the room. I'm sure we all have input on advising. I think this is really what we'd like to do with the community of practice. So, great, thank you.